just outline for you briefly what's the percentage of our national budget which is going into paying for our health care. In 1965, when Medi-Cal and Medicare were implemented, 6% of the total national budget. In 1970, not much increase, but as you can see through 1990, now we're into double digits, and that's almost double now what expenditures were earlier when the programs began. And for 2000 and beyond, we're looking at 14–15%. Now, this all of a sudden translates into $1.5 trillion in healthcare expenditures. Now, health insurance premiums for employers have also been directly affected by rising costs. And one of the big issues that's come up is, well, before, when you had insurance through your employer, because the premiums were affordable, what's happening now with the increases every year, just in terms of the cost, you don't have the same increases in profits. So this is making a dramatic impact on employers being able to pay for insurance for all their employees. So that you multiply this times 20, 100, thousands of times, and it really begins to be significant dollars. So it's not just a matter of $1,000 difference. It's often millions of dollars difference to big employers especially. This is why we have the problems now with even well-known companies like General Electric, the Postal Service, the Safeway, these big companies that have thousands of employees now saying that it's just too expensive to provide insurance to everybody. And so we have to really look at cutting back. And if you're a small company that was barely making it before, you have to stop providing insurance, let alone if you were thinking about it, you're not going to provide it at all. What's happening is that there's a new concept being developed, not only among the insurance companies, but among employers, which they're calling consumerism. And I wanted to give you the idea of what this new consumerism is in terms of addressing the healthcare cost prices. And what it basically means is that wouldn't it be better if we all took care of ourselves and took responsibility so that we actually wouldn't need to use the healthcare system as much? And so this is kind of like the overall concept about consumerism. And I think that it's very idealistic to think that we can impose this on America in general. I mean, there are those of us who like to go to the gym and like to jog and like to diet and like to do all the things that are important to us. But when we look at the rising incidence of obesity and the problems with diabetes and hypertension and anxiety, all those things really have to do with outside forces that as consumers we may not have control. I mean, just think of all the advertising that's being done to get us to be consumers of these products that contribute to these illnesses. So there's a struggle here. We're being told by some of the new thinkers in healthcare that we should be responsible for our healthcare, but at the same time, there's a tremendous amount of pressures to behave, to eat and have behaviors that really aren't conducive to good health. So this is the dilemma that I'm picking up in terms of the way in which the new thinkers of healthcare for the future are trying to impose on us. With all of the money that's being spent on our healthcare, whether it's an insurance policy or the government through Medi-Cal or Medicare, that as the patient or the consumer, somebody else is making all the decisions for you because they're actually paying for it. You have big companies that say, well, what about all this money that you're spending for the health insurance? Who's keeping an eye on it? Well, they usually hire a company like Blue Cross or a third-party administrator to really deal with these issues and on behalf of the employees. So there's really a big disconnect there in terms of the payment for the health care and who's administrating it, and then the patient who's really going to receive it. So this is a big issue, in my opinion, is that people in large companies, and if you're a small company, you actually hire a consultant to develop these plans for you, and they're called third-party administrators and plan administrators. And so if this concept really is that somebody else is making the decisions on behalf of the patient, and somebody else is paying for it. So this really creates a big, big distance between a patient really having a knowledge about what he's getting, what he's going to get, what's going to be cut, and also let alone about the health that they have from a personal point of view. Again, the themes that we keep looking at in terms of personal responsibility, they're saying, okay, let's look at nutrition, let's look at physical activity, and mental attitude. Again, these are very idealistic. If you don't have a good attitude, if you don't lose weight, if you don't have physical activity, it's going to show up on your medical record, and that's going to be translated into some kind of penalty for you. So on the other hand, they're saying this is a positive thing, we want all Americans to do this, and therefore the costs in providing that care will be lower. But realistically, we have to look at the possibilities of this being a general reality for most Americans and immigrants to be part of. We're going to hear a lot about a binary healthcare model. Now, what is that? That means that instead of somebody paying for your health care, an insurance company, somebody else making the decisions whether or not your immunizations are covered, prevention is covered, that somehow we give the patient or the consumer or the employee the money to go out and buy their own health care somehow. Now, that's a very important concept. That's what we're calling new consumerism. As we saw in the early slides, insurance premiums are going up. Employers aren't going to be able to afford it. So how are we going to make these costs less expensive for the employers or whoever's paying for it? Well, the big one is to have the consumer pay for more. The janitors strike in Santa Clara Valley for all the big computer companies was because they wanted the janitors now to pay about $75 a month toward their health care insurance. The goal is that this is going to drive the price of health care down. So a binary model means that you give money to patients to go out and buy their health care, and at the same time, you allow doctors and laboratories and hospitals to say, wait a minute, we've got to give better service, we've got to come down in price, we want to compete for that patient's dollar. So that's what they call the binary model. Another big concept is that because insurance companies pay for our health care, no one really knows what it costs. An insurance company gets the bill and they put it through their administrative process, and somehow they pay some of it, and then they send the patient their part that they have to pay. But it really is after the fact, where the contracts have already been established as to how much everybody's going to pay. But when you really go to a doctor or a hospital or a laboratory and you say, bill my insurance, that's a very strange way to do business. This leads to a real problem when you're now telling people, here's the money, you go out and pay for health care. Now the provider is going to have to tell you up front. That's what we call transparency. That does not happen very much. It happens in our medical offices. We actually publish our prices on our website, and when patients come into our offices, they're told up front what the cost is going to be. And so we've been practicing transparency for a long time because our pricing really is attractive when you compare it to anybody else. They know that if they go to another physician or another laboratory or another provider like a emergency room, they know that it's going to be a huge bill.